Now this little dog has just presented to be looked at today. This one actually has kennel cough, but this can be the predecessor to the respiratory illness. It'll start showing as mild kennel cough, and it gets chronic. The difference is a wet cough versus a dry cough. With kennel cough, it's generally a wet cough, and they produce a lot of phlegm and all in their throat, and they spit up foam and stuff like that. With the dry coughs and all, that's more of a pneumonic, and that's deep down in the chest, and that's a lot more important. But this one, this is chronic kennel cough. It's lasted about 2 weeks so far, and we're going to put antibiotics in this dog's system, and a little bit of steroid for the swelling and reactivity that's going on, and a little bit of Lasix because the chest's a little wet, and that'll pretty much cover this one. But the respiratory syndrome that is starting now, and that's we're starting to see in the United States, starts with something similar to this, and it can go from mild to very, very severe quickly. They can get a wet pneumonia that'll take them out in 3 or 4 days. And we've got to get into oxygen therapy and nebulizers and IV antibiotics and everything else. They don't know what this syndrome is yet. They don't know what's causing it. All they're seeing is the effects, and they're still working on the actual pathogen.
Okay, so how would you say dog owners can protect their dogs from something like this?
The best thing to do, and that's one of the reasons they brought this dog in, they wanted it vaccinated for Bordetella. Well, I can't do that right now because this dog actually has a chronic case. But the vaccinations for Bordetella is the beginning. That's one of the smarter things to do. Here at this hospital, we use the intranasal. I think it works a little bit better. It concentrates in the nose and works a little quicker, and it's a little safer. Stay away from the parks, particularly if they start talking about the syndrome is in Texas. Stay away from the dog parks. Stay away from the groomers. Any place that you have a concentration of dogs, you're going to have a concentration of viruses. Don't board your animal unless you have to. And then it might be a good idea to board it at just the veterinary hospitals, because most of the clinics spend half the day cleaning and trying to keep things fresh. So that may be the safer places to be. But the regular boarding and stuff like that, I would avoid it if you can. Leave your pet at home, either that or take it with you if you go on vacation.
Okay. And any opinions or ideas as to why this respiratory illness has suddenly popped up in the U.S.? And is it something that happens every year? Or?
It's not. This thing has got everybody baffled. Even the AVMA, the American Veterinary Medical Association, they have no idea. And because they haven't identified the pathogen yet, that's a problem. They need to identify the pathogen so we can test it and destroy it. And they just don't have a clue yet. They're working on it feverishly. Colorado State has really started in a lot of testing and stuff. And of course, right now this thing is kind of concentrated on the West Coast. Oregon, for some reason, is a hot spot. Colorado's a hot spot, and good old Florida. But Texas and New Mexico, Oklahoma, we're so dry, we're generally the last ones that see these pathogens show up, and right now there hasn't been any reported cases.
Knock on wood, right?
Yeah.
So what are some symptoms, or when would you recommend is a good time to bring your dog in to get looked at if you're worried?
Well, number one, if you're worried, you call your vet. That's kind of an owner call. We'll always tell you to bring them in just for a quick check and all. But these guys, they'll start out, from what I've understood and what I've read, they start out very mild. They start out with signs of early kennel cough, and trying to clear their throat and maybe a little foamy, and it becomes chronic. After it becomes chronic, that's when it starts getting dangerous, because if it does go into the secondary, then that's when they develop the pneumonia and all, and it's a deep-seated, deep chest pneumonia that they'll develop, and those are hard to control. They're hard to treat. Again, like I talked about earlier, we've got to get into oxygen therapy, which is one of the main treatment regimens is oxygen therapy. Nebulizers work well because you can actually mix your antibiotics in the nebulizers and vaporize this stuff to them. Anything like that helps. But if it reaches the chronic stage, the pneumonic stage, then it's a big deal.
And is this something that could cause like lifetime complications?
It can cause some lung scarring and problems like that. It's not going to cause the organ problems like some of these other diseases will, but it's just like a pneumonia in a human. It can cause a lot of scarring in the chest.
And that's obviously,
Obviously,
no amount of
not a
scarring
good
is
thing.
going to be a good thing.
Okay, baby.
She said, I want a minute in the spotlight.
Yeah.
All right, you got anything else you want to add?
I think that pretty much covers it. We hit the states and everything.
Yeah.
Okay.
And how often do dogs need to be kept up to date on vaccines that can help prevent things like this?
The Bordetella, we used to recommend once a year on Bordetella. The last couple of years, we said every 6 months because Bordetella, kennel cough, got very prevalent in this area. And a lot of the groomers have kind of followed what we've said, and they require every 6 months. And it's just a good vaccine, particularly the intranasal again. That's what we use, and that's what we have very good luck with. But every 6 months on it. And I would at least make sure your dog is vaccinated for Bordetella. And, with the possibility of this respiratory disease coming this way.
Even if they don't go to the groomer?
Even if they don't go to the groomer, yeah.
All right.
It's a good vaccination that works.